bang. That's the loved one hitting the ground. Would you know what to do if one of your loved ones suddenly stopped breathing? Well, I didn't. My grandfather at a family gathering years ago complained of indigestion all day. Well, it was not just indigestion. He ended up with a full-blown heart attack. He stopped breathing. My family didn't know what to do. We called 911 and we stood there waiting for help. It was the most helpless feeling ever. And I swore I'd never go through that again. Well, 15 years later, and I'm a registered nurse and been certified for CPR for over 10 years. I would like to show you a simple life-saving procedure, CPR, cardiopulmonary resuscitation. So we're going to start off with learning 3 letters, C-A-B, CAB, compression, airway, breathing. Okay, compressions is first, airway is second, and breathing is third. But first off, scene safety. Check to make sure everything is safe. You do not want to endanger your own life. If patients been electrocuted, do not touch them. Calling 911. You need help on the way. Scene safety, 911 called. Now you're going to assess your patient. So you walk up to the patient. Sir, are you okay? No answer. So you're looking, examining, no chest rises, you don't see any breathing. You're going to lean over, check the pulse rate here in the carotid. Use 2 fingers, never your thumb. No pulse, no breathing. You know CPR needs to be started. And we know that it's going to start with C, compressions. You use your dominant hand, other hand over. You're going to push down in the middle of the chest. We know that it needs to be at least 2 inches deep. Push hard, push fast. That's the one thing I want you to remember from this video. So, dominant hand, other hand, middle chest, 30 to 2 breaths. Arms straight, and you're going to compress fast. 100 to 120 compressions per minute. So before I demonstrate that, I want you to make sure that you're looking around, everything's good, and we're going to start. I'm going to demonstrate 30 to 2. And here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And you're going to put your hand on the forehead, tilt the chin up. Nothing visible in there. Sweep if there is, and 2 breaths. Deep breath, and in. Then you would back right to compressions. You would do this until help arrives. So you now have done all 3, compressions, airway, and breathing for your patient. You do this in a cycle of 2 minutes. Every 2 minutes, you'll be rechecking for the pulse. Push hard, push fast. Most important thing I want you to take away from this. I know that we didn't help my grandfather as much as we could have, but he had a good outcome. With the paramedics arriving fast, he had a full recovery, and we were very grateful. But it was the worst helpless feeling ever. So I encourage you to learn after this video to go get certified for CPR. They have classes at convenient times. If not, I hope you've learned something from this demonstration. Thank you.